Hello everyone, this is Dr. Williamson. Welcome to Module 12, Musculoskeletal and Integument Function. For this module, you'll see the overview here up top, and it'll explain just a general overview about your integument and your musculoskeletal system. You've got your learning outcomes below that and your learning experiences here. So for the Module 12 assignment, I'm going to explain that in just a moment, and then this content will be included in the comprehensive final exam. You'll have final questions that will be available for you, final review questions, just like you do with every other unit. So be sure you review your PowerPoints and your resources to enhance learning. That will help you study for that. So for this module, what you're going to see is that you're going to have a case study assignment, but it's going to be different than what you've had on your case studies before. So you're going to select between one case study or the other to answer your questions. Let me show you those. So this is case study 1. Then case study 1, move up to the top here. Case study 1 is entitled Disorders of the Musculoskeletal Function and Rheumatic Disorders. And if you'll see there, it gives you a case, and then it gives you a question related to etiology. It gives you a question related to pathophysiology of the disease, and you'll see that it's labeled question number 1, and then you'll see pathology of the disease question number 2, and then treatment options that's available for your patient. So that is your case 1. Let me pull up case 2. Case 2, if you choose this one, this is musculoskeletal function, developmental and metabolic disorders. It gives you the case here, and it's set up the same way. You've got an etiology question, you've got your first patho question, and you've got your second patho question, and then treatment options there. So you're going to work through this case and you're going to submit it, but you choose either case 1 to answer or case 2 to answer. So that's up to you. We put that up to you for whatever you wanted to use for that. So that is completely up to you. So let's go back to your grading rubric here to look at this. So it tells you here that you choose one of the cases to answer the questions, and you're going to format the document with the case study you selected. So you'll say at the top of the document for ENU 513, I've selected case study 1. So it would be ENU 513, case study 1, and then you would include your name below that. You're going to use the format below as your headings. So like number 1 is going to be etiology of the disorder. So that's going to be your first heading. Then the second heading would be pathophysiology question number 2. Third heading, pathophysiology question, 1, pathophysiology question 2, and then heading pathophysiology, treatment options there. So you answer it, but it tells you exactly here. So that's your headers for the document after you've put your name and everything up at the top, like it said. Then in this first section is worth 25 points. You're going to identify and introduce the disorder or the disease process from the case study, most likely associated with the scenario. You're going to answer that in 200 words or less. For that, you're going to provide specific details of the disorder, including the underlying causes, the symptoms, the manifestations, and the complications. So if you wanted to use subheadings on that, you could. Be sure that you include in-text citations to support your 200-word answer right there for etiology, and include all of that in there. That's worth 25 points. Then for question number 1, this is the question that's listed on your case study, and you're going to provide specific details related to the pathophysiology question.
Sorry,
and
fine study, and you're going to do up that provides in your music.
Siri is listening to me and is trying to answer my questions. So she's trying to help you out there. So you're going to answer question number 1. So let's go back to that so you can kind of understand it and I can explain it a little better. So for pathophysiology for the question 1, because you've already did the etiology. For question 1 here, it says, why is osteoarthritis of the hips a potential secondary complication of this disease? And what are the structural changes that occur in the articular cartilage of an osteoarthritic joint? So let's minimize that back down. So what you'll see is you use your Porth text and other resources, and you're going to provide the specific details related to the pathophysiology question number 1. So answer this one in 200 words or less. Include, if you use Porth and another one, include in-text citations for both of those, and you're going to include a reference list at the end of the document. So then for pathophysiology question number 2, you're going to use your Porth text and other resources. And you're going to provide specific details related to the pathophysiology question. But for this one, you can answer this question in bullet form format. So 8 to 10 bullet points minimum on there. So when you're doing that, include the bullet point, and if it comes from Porth, then you'll cite Porth at the end of the bullet point. If it's from some other source, cite what other source it's from at the end of the bullet point, so we'll know where your answer came from. And then treatment options, it's the same thing for your last answer. Using professional resources, list appropriate treatment options for the disorder and the disease. So you're going to answer that in bullet point format as well, with 8 to 10 bullet points minimum on that. So what that's saying is you can have many more than 8 to 10 bullet points, but that's your minimum. Same for this one as well. And so on here, this is not a scholarly paper, but you are supposed to, especially in question 1 and 2, you're supposed to do scholarly writing there. So be sure that you include appropriate in-text citations there. You're to use 3 professional references total. So between all of your answers, use 3 professional references total. 2 in addition to your Porth text. Scholarly writing, which should include spelling, grammar, logical flow when you're answering your questions. So the note is here, it's not a formal paper. You can answer the questions in first person, so that means you can say, I believe, blah, 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 but you've got to have something to support your answer. So I believe blah, 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 because Porth says this. According to Porth, this is whatever the pathophysiology answer is or whatever. So it's okay to do that in first person because I've said it here. So you've got to follow the guidelines listed above and then submit it by the due date and time. So I think that's all on here. Let me minimize this here. So I wanted you to see. So here's your submission link. So when you get your answer sheet completed and written up, have your name on it, then be sure that you submit it here through the submission link and by the due date and time. So I hope that helps you understand this assignment a little better. I hope you'll enjoy the assignment, and I hope you have a great week of learning.